Now, whenever we talk about speech, we also like to talk about swallowing as well. And some Parkinson patients can run into problems with swallowing. And it's important that you understand this because aspiration pneumonia, or swallowing either food or liquids down into the lungs, can develop a reactive process called a pneumonia, and this could be the leading cause of death in an average Parkinson disease patient. And so we worry a lot about swallowing function. And it's important, if you're having problems swallowing, or if when you're eating you notice that you're coughing a little bit because maybe that food's going down the windpipe and not down into your stomach, it's very important that you bring that to the attention of your doctor, either your primary care doctor or your neurologist, because again, just like in speech dysfunction where we have exercises that can help for speech, we also have several things that we can do for the swallow. And it's important, if swallowing problems are identified, that you get a swallow test. And the way that this works is the speech and language pathologist will give you a little bit of a dye to swallow, and they'll take an x-ray, and they'll watch and see how all the different elements of your mouth, so your tongue, your cheeks, they'll look at the back of your throat, and then they'll look at your esophagus and your windpipe to see where that dye is going and making sure that all of the different muscles are all in complete synchrony. And so it's like an orchestra, and you probably don't think of swallowing as an orchestra, but in order for you to get the food from the plate all the way down into your stomach, all the different pieces of the orchestra have to play in sync. And so if something's out of sync, some of that food or that liquid's going to get down into the lungs, and it's going to cause problems, and it may even cause an aspiration pneumonia. And so it's very important, if you're having swallowing dysfunction, to get a referral to a speech-language pathologist, to get a swallow study, this dye study, to see what's going on, and then to implement the tailored rehabilitation strategy to try to improve swallowing dysfunction. Now, there are a number of researchers who are endeavored in developing new techniques to try to prevent aspiration pneumonia. One of the new techniques that's showing promise is called expiratory muscle strength training. And this is a type of exercise. It's a little device that you can blow into, and it actually strengthens the swallow response and strengthens the muscles that allow you to swallow normally. And so we're starting to get a handle on these issues. But it's very important as you go down the list with your doctors, if you're having difficulties either swallowing liquids or you're having difficulty swallowing certain foods or certain types of consistencies of foods, that you bring that to the attention of your physicians. You get a referral to a speech-language pathologist, and you find out exactly what's going on and have a therapy that's tailored to what the dysfunction is in your particular case. Listen, being able to swallow and enjoy food and enjoy meals is probably one of the 2 or 3 best things you can do in your life. And so if this is something that's affecting your quality of life, bring it to the attention of your Parkinson's disease expert or your general doctor and make sure that you get the right solution for your problem.